Today I'll be discussing if people with diet-induced obesity are at a greater risk for COVID-19. The obesity crisis in America has been referred to as its own epidemic. What happens when you mix together an epidemic crisis and a pandemic crisis? What will happen to all the people who are obese in the world's population today that are now having to also worry about being infected by the novel coronavirus? Are people who are overweight at a greater risk for COVID-19? In this video, I would like to discuss how people who are overweight are affected by this virus, if they're more susceptible due to their weight and unhealthy lifestyle, and if it's harder for them to recover from this deadly virus. You may be wondering, what is even considered obese? A BMI of over 30 is considered to be obese, but oftentimes BMI is not our best indicator of obesity, due to the fact that BMI is simply a measure of body fat, based on someone's weight and height. BMI does not take into consideration muscle mass and other factors that contribute. A more accurate way of determining obesity we have found is calculating someone's body fat percentage. Men with a body fat percentage of 25% are considered to be obese, and in women, a body fat percentage of over 33% is considered to be obese. Some ways, but not the only way, to calculate this measurement are through hydrostatic weighing, air displacement or BOD-POD methods, bioelectrical impedance analysis, and bioimpedance spectroscopy. Obesity has reached epidemic proportions on its own in the United States and in much of the westernized world, contributing to a considerable amount of deaths. Several of these obesity-related deaths are associated with a greater risk for death correlating with the coronavirus and other complications, including respiratory failure, need for mechanical ventilation, and higher mortality. Due to all these complications, clinicians need to be more aware and more aggressive when treating obese, especially severely obese patients infected with COVID-19. According to the World Health Organization, overweight and obesity are defined as abnormal or excessive accumulation of fat that poses a health risk. In 2016, more than 1.9 billion adults aged 18 and over were overweight, and of these, 650 million were obese. In a recent evaluation, obesity was present in 42.4% of the North American population alone. Studies have found that patients which were overweight or obese had a 72.1% prevalence. Patients with a BMI above 40 had higher risk for novel coronavirus infection. In hospitalized patients with BMI higher than 35, invasive mechanical ventilation had to be used in 85.7%, and those with a BMI above 30 and that were forwarded for mechanical ventilation presented a mortality rate of 60.9%. The recommendation and necessity of mechanical ventilation increases with the increasing BMI. It was also observed that young patients positive for COVID-19 with severe obesity would evolve more frequent needs for medical care, in particular requiring complex procedures such as those provided in intensive care units. Overall, the consulted literature research suggested that the coronavirus disease can be added to the list of high-risk conditions affecting the obese population. Obesity is a metabolic disease characterized by a hormonal, anti-inflammatory, and pro-inflammatory endopectins imbalance due to excess of dysfunctional adipose tissue. This imbalance interferes with the activation of the immune system, which can generate a bad immune response and consequently a worse prognosis for the obese. Obesity is a factor of poor prognosis for infection with the novel coronavirus, both because it worsens the infection and because it increases the prevalence of hospitalizations, with worse outcomes and greater lethality, mainly when co-occurring with with chronic conditions and in the elderly. In the view of the current pandemic, greater attention is suggested to the obese and the overweight populations. All in all, a healthy diet and an active life is always the best way to live, to try and prevent obesity and other health complications. Proper nutrition is not only important for your body, but for your mind as well. So, as long as we remember to treat our bodies with love and care, especially during these trying times, we all should be fine in the end. That is the end of this presentation, and I hope you all enjoyed and try to stay active and healthy during these hard times.